I'm Dr. Emily Charlesworth. I work at the Vision and Eye Research Institute and the Centre of Inclusive Community Eye Health at Anglia Ruskin University in Cambridge. Our overall aim is to improve eye health awareness and reduce the risk of blindness. Diabetes can affect many parts of the body, including the eyes. In this video-based workshop, we will discuss various topics such as what diabetes is, how high blood pressure and high cholesterol can impact diabetes, how to reduce your risk of diabetes, how to self-manage your diabetes, and why diabetic retinal eye screening is important. We encourage discussion, so if you have any questions, please ask them at the end of the video. Thank you.
You look a bit upset. What's the matter?
I went to see my doctor last month. He did some blood checks and said that I have diabetes.
Do you know what is diabetes?
It must be some kind of blood disease. But I am not entirely sure.
Diabetes is a serious disease that occurs when the glucose or sugar level in the blood becomes high. Glucose is the main source of energy for our body and comes from the food we eat. This glucose needs to be converted into energy. Insulin, a hormone made by the pancreas in our body, allows glucose to enter the body's cells where it is converted into energy, thereby maintaining the required healthy level of glucose in the blood. It is not good for the body to have high or low levels of glucose in the blood. But sometimes our body doesn't make enough insulin or does not use the insulin too well. This means blood glucose levels rise, and this is harmful to the body.
That is interesting. But, if we have more glucose in the blood, is it not good as our body needs glucose all the time?
No. Over time, high glucose levels in the blood can lead to problems such as heart disease, stroke, kidney disease, eye problems, nerve damage, and foot problems. That's why it is important that your blood glucose level is kept under control.
My doctor advised me to make sure that my blood pressure and cholesterol levels are also controlled properly. What has blood pressure and cholesterol got to do with diabetes? Surely they are different.
Your doctor is right. It is very important to control your blood pressure and cholesterol levels if you have diabetes. Diabetes can damage the small blood vessels in your body. The combination of high blood pressure and diabetes can greatly increase your risk of having a heart attack or stroke. High cholesterol and diabetes also increases this risk. One thing that is important to note is that having diabetes is not your fault, but it is really important that you do everything you can to control your blood sugar.
What test is done to find out if someone has got high blood sugar level?
There are different tests. One test is called HbA1c test and the other is fasting glucose test. In the HbA1c test, the average blood sugar level over the last 2 or 3 months is measured. In this test, a value of 6.5%, or 48 millimole per mole or over, means you have got diabetes. In the fasting glucose test, blood sugar level after not eating for a few hours is measured. In this test, a value of 7 millimole per liter, or 126 milligrams per deciliter or over, means you have got diabetes. If you have got high blood glucose levels, you may also feel very thirsty, weak, or tired, peeing a lot, and your vision can get blurred.
I heard that diabetes is an age-related disease. Is it true?
No. Diabetes can affect anyone. Type 1 diabetes mostly affects children, in which the body cannot make enough insulin. In adults, type 2 diabetes is more common, where insulin is not utilized effectively by the body. Around 10% of all diabetes is type 1, and rest is mostly type 2.
Are there other types of diabetes?
One other commonly known diabetes is the one which can occur during pregnancy, but it usually disappears after giving birth.
I have been seen and treated by the doctor last month only. I hope that this will now control my diabetes. So now I don't need to do anything.
Yes, although doctor's treatment is important, you also need to take ownership of your diabetes and not just leave it to your doctors. Good control of your diabetes is up to both you and your doctor. There is a lot you can do to make sure that your diabetes is well controlled. In addition to taking the medicine as prescribed by your doctor or nurse, make sure that you do not miss any doctor or nurse appointments. Please don't change your medication unless the doctor advises you. You must also do everything you can to keep your diabetes under control, such as eating the right kind of food and doing exercises.
What else do I need to know more about looking after my diabetes?
Do not take any herbal or traditional medicine without consulting a doctor. Eat healthy foods such as salads, spinach, and vegetables. Have meal portion with half the size of the plate filled with salad, 1/4 filled with cooked vegetables, chicken or fish, and the remaining 1/4 size filled with chapati or rice. Eat salad first in the meal. Eat less rice, and less potatoes. Also, eat less fried and salty food. Eat your food slowly. Eat less amount of red meat and purified butter. Avoid sweet and sugary foods. If anybody persuades you to eat such foods, simply decline. Be especially careful during times of festivals and celebrations. Do not eat whilst watching TV, as this increases the risk of overeating. Drink lots of water. Do not smoke tobacco and cigarettes. Try to lose weight if you're overweight. Also, exercise is very important. Do at least 150 minutes of exercise every week, such as brisk walking, running, and cycling. You may do this alone or with your family member or friends. Exercise does not have to be in one go. You can do it little by little, but walk at least 30 minutes a day. You can start from a slow walk and move towards vigorous walking or running. When you go out, do not walk on bare feet. Otherwise, it can cause wounds. In diabetes, healing of wounds is difficult. If you spend a long time in office work, walk around at frequent intervals or go to make tea or coffee. Seating needs to be regularly broken up with standing. Yoga, praying and meditation will help, as it will help you calm down. If you are stressed, your diabetes can become worse. Talk about your diabetes with your family members so that they can support you better. Join the diabetic support groups if available and learn from the stories from peers on how they have been managing the diabetes successfully.
Thank you. Can you please explain how eating healthy food and doing physical exercise is important in preventing blindness due to diabetes?
Eating healthy food and doing physical exercise helps to keep blood sugar levels under control. This reduces the chances of damage to the blood vessels at the back of our eyes, thus, prevents blindness. By the way, have you received a letter from the NHS or your doctor inviting you to have a diabetic eye screening?
If I can see clearly, why would I need diabetic eye screening?
Yes, even if you can absolutely see clearly, it is important to attend diabetic retinal screening. In this test, the doctor takes a picture of the back of your eyes and sees if it is affected by diabetes.
Oh, I just went to the optician to check my eyes for glasses last week. So why is it necessary to go again?
Yes, it is absolutely necessary, as the test for checking the prescription of your spectacles is different from this test, which involves taking photographs of the back of the eye. Regular retinal screening, as advised by your doctor or nurse, will reduce the risk of blindness by 60 to 90%. The chances of blindness from diabetes are even more in some ethnic groups, including South Asians and black people, and in those with poor socioeconomy, obesity, high blood pressure, cholesterol, and tobacco use.
But I still don't understand. Diabetes is in the blood, so why is this retinal screening important? Diabetes is not in my eye.
Yes, you are right. Diabetes is not an eye disease, however, in the back of your eyes, there are small blood vessels, which ensure that your vision remains clear. The high blood sugar levels in diabetes can affect these blood vessels, which may bleed and cause further damages, therefore leading to blindness if not treated on time.
Okay, I will attend retinal screening appointments. However, will I need to buy another pair of glasses?
No. Glasses are not given during diabetic eye tests.
How often should you have this retinal screening test? I know my mother had hers 7 years ago.
That was a long time ago. Even if you can see clearly, nevertheless, you must attend a retinal screening test once every year, or as advised by your doctor or nurse.
How can you prevent blindness as a result of diabetes?
If you have any worries, you must consult a doctor. Do not ignore any diabetic screening or diabetic eye screening requests. Try to make sure that your blood sugar levels are controlled through good diet, exercise, and enough sleep. Do not miss the checkups with the doctor or nurse, and make sure that blood pressure and cholesterol levels are controlled.
Thank you so much for sharing the knowledge with me. I will make every effort to do everything that you explained to me, and I will go for diabetic retinal eye screening at least once a year.